Imagine falling sick and having to choose between treatment or child's education. I am Stuti Banerjee, and with my teammate Agna, we are Team Health Wallet. Today, we present the harsh truth of out of the pocket health expenditure in India. We wanted to find out how these costs affects families across India, rural and urban. Does insurance help, and where are the biggest gaps in the system? So, for our study, we used the data from National Sample Survey, two rounds from 2017-18 and 22-23. It covered over 1 lakh households from both rural and urban areas. We looked at spendings on hospitalization, outpatient care, insurance coverage, and whether families had to borrow or sell assets. Now, let's look at what the data tells us. In 2017-18, rural households spent over rupees 16,000 on hospitalization, urban ones over rupees 26,000. Even in 2020 to 23, over 90% of the rural expenses were still out of the pocket. Outpatient costs, rural families spent rupees 539 per month, urban ones rupees 606 per month. Small numbers that add up but aren't covered by most insurances. Only 14% of rural and 19% of urban people had any insurance in 2017-18. Just 1% of the urban families were covered by government schemes.
Serious illness like cancer raise costs, averaging over 57,000. Nearly 28% of families borrow or sell assets for treatment. So, what does this mean? Families, especially in rural India, still bear most costs themselves. Insurance is not helping much. Most daily healthcare needs like OPD visits are not even covered. And when serious illness hits, it pushes family into debt. So, what can be done to reduce this burden? We need better insurance, easy to access and understand. Outpatient care and tests must be included. Public hospitals need upgrades so people actually use them. And there should be price caps on costly treatments. So, what's the real cost of getting sick in India? For many, it is not just bills, it is broken dreams, soul lines, and lifelong debt. Big health schemes exist, but people, especially in villages, still pay from their pocket. We need a system that protects health, not punishes the sick. Let's not just treat illness, let's treat the system. Thank you.